Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy, part 31, Kali Sulph 3. Kali Sulph for sleep troubles, vivid dream during sleep, nightmare, picture 1. Restless sleeps, picture 2. Sleep breaks often, gets up from sleep too early, picture 3. Kali Sulph for febrile symptoms. Temperature increases from evening till midnight, then it drops. Kali Sulph produces sweat and decreases body temperature. Intermittent fever with sticky yellowish coated tongue. Picture 4. Fever from poisoning of blood, gastric fever, enteric fever, typhoid, when desquamation starts in eruptive fever and cold sweat is there. And for all this condition, Kali Sulph is the medicine. Please read it again and again. These are very important symptoms, and you will face this type of patient in the chamber very often. Kali Sulph for skin disease or skin symptoms. All wounds on skin where from thin yellowish watery secretion occurs. Sometimes skin peels off from around dry skin. Use externally also. That is in case of skin disease when you give medicine orally. The same medicine in powder form mixed with some bland medium like glycerin, Vaseline, olive oil, water like things can be applied on the skin disease also, and this would make the cure very fast. It has been seen in practice. Epithelial cancer, mind this, epithelial cancer with the discharge of thin yellow serous matter, eczema with discharge yellow greenish, watery or when suddenly suppressed, sudden retrocession of the rash from a chill or other causes in any eruptive disease like measles, pox, scarlet fever, etc. And skin becomes rash, dry. The patient becomes restless, sleepless. A few doses of Kali Sulph and ferrum phos 6x alternately would pacify the patient to go into deep sleep. When you apply this medicine and it acts, it's a joy for both, for patient and doctor as well. Very nice and very smooth action of this disease. Just you have to be confident, you have to be knowledge, you have to acquire knowledge and apply this in a particular place. Kali Sulph for tongue symptoms, coated yellow and slimy, often with white edge, insipid, pappy taste, lips, gums, tongue white, taste loss. When there is loss of taste, say for not in acute condition, maybe in subacute or chronic condition also, the Kali Sulph will come and wipe out these difficulties from the patient. Just give, I have tested it personally. This is tongue, this is the cancer, this is also cancerous developments, and this is peeling off of skin. General modalities of Kali Sulph. Number 1, aggravation in evening in one room, hot environment, closed room after taking oily foods. Number 2, amelioration from cold weather, open air after midnight. This thing, all these different aspects have been demonstrated with the help of images here. The same thing, just check it. Unfailing guidance to Kali Sulph. Due to disease condition including cancer when exuded sticky, yellowish or greenish. Number 1. Number 2, tongue is covered with yellowish coating. Number 3, case makes dry, rough skin smooth. Number 4, patients irritable, headstrong, anxious, like to stay alone, avoids company. All their troubles are better in open, cool air and after midnight. Worse in closed room, warm and hot environment in the evening. Number 5, shouting in sleep, get frightened in sleep. Number 6, in any disease condition arising out of suppression of skin disease, when KS is used, skin disease reappears. The diseased condition is cured. Finally, original skin disease is also cured. The pictures or images represent some of the symptoms. Please check it. Tubercular spine. Tubercular spine actually it is deformity of spine. It's called scoliosis. This is the healthy spine. Note, this is healthy spine. This is lumbar scoliosis. That is, in lumbar region there is abnormal bending. Thoracic scoliosis. In the thoracic position there is abnormal bending. Thoracolumbar scoliosis. Thoracic and lumbar both combined scoliosis. So this scoliosis actually is a manifestation of tubercular infection, very deep tubercular infection, and Kali Sulph is very effective in such case. Though it is some type of hereditary, or rather from birth, by birth this scoliosis is seen, but yet I am sure that if the medicine is given in a young age, the scoliosis may be cured also. Mind it, this is an anatomical abnormalities. This very anatomical abnormalities is very difficult to cure, but I am sure Kali Sulph can do it if it is administered in very young patient. Like this patient, Mr. Sibhatnagar, aged 45 years, his health was apparently disease-free. His spine was arched like a bow. He had no mentionable family history, neither any important past history. For last 10 years, he had been suffering from cough and cold and used to expect thick, rich, yellowish mucus very often. Expectoration had no odor, but he suffered from halitosis, bad breath. He liked open air very much, the reason for which he came to chamber during past 2 months. He suffered from sufficient amount of hemoptosis, that is blood vomiting, for 3 times. Blood was bright red, sometimes sputum after cough, containing filament-like substances. After hemoptosis, he got himself treated with modern allopathic remedies. He approached to me hoping for cure from the root. Somewhere he learned this, that we can cure it from the root, not just relief. I prescribed Perampos 200x and Kali Sulph 200x once a week, alternately for 6 weeks, and also ordered for radiograph of chest and Mantoux test. His MT was positive, but X-ray was clear. His treatment was continued for 6 months at a stretch. Hemoptysis did not occur anymore. Cough and cold still continuing with occasional remission. Now the same remedies were prescribed once for a fortnight. Note there, the symptoms represent some infection of tubercular type infection, and tubercular type of infection, that's why his MT was positive. Mantoux test was positive, but there is no active pathology since radiograph shows nothing. Mind it, the disease condition, the first disease comes in the dynamic stage, then dynamic disease settled and creates a pathology. Now here the person is suffering from dynamic level, not the thing has not yet set. So his radiograph was clear, but I am sure this medicine will cure this latent tubercular state. He is suffering from that thing. Here the video ends. Many thanks for listening and viewing. If you feel any difficulty, I got something to say, please write down in the comment section. I will certainly respond.